Good morning and welcome to Webinar Wednesdays with SMP. We're glad to have you all here with us this morning. My name is Sunny Lawless and I'm the volunteer coordinator for our SMP programs, and I'll be your host for this morning. Presenting today will be Nathan Coughlin, who is one of our Georgia Community Outreach Specialists, and Johnetta Red, who is one of our Mississippi Community Outreach Specialists, but she's now doing complex interactions. Today, for the April installment of Webinar Wednesdays with SMP, we are going to discuss genetic testing fraud and scams. During the presentation, you're welcome to type in any questions that you have into the chat, but we are going to hold those until the end of the presentation when we open it up for question and answer. We're also going to hold a prize drawing at the end of the presentation today. So anyone who was registered to attend this webinar before 10:15 a.m. this morning has been entered into the drawing for either a $25 Walmart or Amazon e-gift card. So we'll be doing that at the end of the presentation, and you must be present to win. Before we get started, we do need to let you know that this project was supported by a grant from the U.S. Administration for Community Living. Grantees undertaking projects under government sponsorship are encouraged to express freely their findings and conclusions. Points of view or opinions do not therefore necessarily represent official Administration for Community Living policy. So who is Senior Medicare Patrol? Well, SMPs are grant-funded projects of the U.S. Department of Health and Human Services and the U.S. Administration for Community Living. All SMP grantees have a shared national identity through a national program name and logo. Every state has an SMP program. In Georgia, Louisiana, and Mississippi, SMP is sponsored by AdviseWell. And our mission is to empower and assist Medicare beneficiaries, their families, and caregivers to prevent, detect, and report healthcare fraud, errors, and abuse. And we do that through outreach, counseling, and education. And last year, we celebrated our 25th anniversary of the SMP program. So before we get started today, we do have a quick polling question for you. Our polling question is, have you ever been asked if you want a genetic test to screen for cancer or heart disease? So let's see, I'm going to launch the poll, and you should see that question appear on your screen. Have you ever been asked if you wanted a genetic test to screen for cancer or heart disease? So please answer yes or no, and I'll give, we'll wait a few more seconds and give everyone a chance to answer. Right now we're at about 70%. I'll give about 5 more seconds and then we'll close the poll. All right. So we'll share the results with you. So it looks like an overwhelming 100% of you that responded have never been asked if you want a genetic test to screen for cancer or heart disease. So we're going to go into detail about what is genetic testing and what are the cardiovascular genetic testing screenings and why it's so important for you to pay attention when you receive those offers. So I'm going to hide the poll. Let's go back to our screen. All right, now I'm going to turn things over to Nathan, who is going to get us started with more information on genetic testing.
Hello, everyone. My name is Nathan Coughlin. I am an outreach specialist here in Georgia in the Atlanta area, and I'm going to go into more details today about our topic. I'm glad to hear none of y'all have been asked about it, but it's probably only a matter of time. It's a very prevalent scam that's happening. So the CDC describes genetic testing as a series of different tests that can provide information about various genetic disorders or your potential risk to develop certain types of cancer. There are several different ways the sample may be taken. Could be a cheek swab, could be a blood sample, or could be a saliva sample. Genetic testing fraud and scams are one of the biggest issues facing Medicare beneficiaries currently. These scammers are offering these tests for free, I put free in quotes there, to Medicare beneficiaries. They then bill Medicare for tests that are not medically necessary, and in most cases, the beneficiary or the personal physician may never receive any results. Genetic tests should only be ordered by your personal health care professional when he or she deems it necessary. I can't count how many times I've been at a senior center. This is particularly pre-COVID, especially. And the senior center director, was duped by one of these people coming in offering things for free, and they thought they were doing the right thing. It just shows these scammers can be very tricky, even to those that are in the industry. Next slide. There are many different types of genetic screenings and tests. Cancer screening, DNA screening, and hereditary cancer screening are just a few examples. Remember, genetic testing should only be ordered by your personal healthcare professional when he or she deems it necessary. This really mirrors if you were part of our webinars talking about DME fraud and back brace and knee brace scams. Very similar. It doesn't mean that the scams themselves are a scam. The tests themselves are a scam. It just means you want to talk to your own personal doctor about it and have them order it. Next slide. These scammers may come to your local senior center, senior apartment complex, or senior health fair event that you are attending. They may ask you questions about your family or personal healthcare history, such as, has anyone in your family had cancer or have you had cancer? They will then offer to perform a genetic test that they claim will tell you your chances of developing cancer. One of the latest growing genetic testing fraud trends focuses on cardiovascular genetic testing. We are hearing reports of scammers calling Medicare beneficiaries claiming their cardiologist or provider wants them to have this test and are offering to send a kit. In reality, their provider did not make such a request. We're going to go to a couple of examples of cardiovascular genetic testing fraud. A company offering you free or at no cost to you testing without treating a physician's order and then billing Medicare. Remember, a great little tip to keep in mind when it comes to Medicare fraud: if something is truly free, you will not need to give your Medicare number. A company using telemedicine to offer testing to you over the phone and arranging for an unrelated physician or teledoc to order the tests. Billing Medicare, usually thousands of dollars, for a broad range of cardiovascular genetic testing that you did not request or possibly even receive. A company calls you sharing your doctor or cardiologist requested that you have the testing done, and they will send you a testing kit. So just like I spoke about, these tests are inherently a scam. There are times where Medicare does deem them necessary. So we're going to get into some tips about when are those genetic tests actually covered. So when someone has stage 3 or stage 4 cancer, when the test is medically and reasonable and necessary, federal regulations define medical necessity as services or items reasonable and necessary for the diagnosis and treatment of illness or injury or to improve the functioning of a malformed body member. When it's ordered by a treating physician, federal regulations define a treating physician as the physician who furnishes a consultation or treats a beneficiary for a specific medical problem and who uses the results in management of the beneficiary's specific medical problem. Tests not ordered by the physician who is treating the beneficiary are not reasonable and necessary. So I know that was kind of a very long, technical sounding phrase that I just told you, but essentially it just goes back to always asking your actual doctor about that need. Scams can happen in person with actual doctor's offices, but this type of scam is much more likely to happen over the phone or the internet. When one or more coverage requirements are met for a colorectal cancer genetic screen, there are no Medicare coverage for genetic testing as a screening service when a treating physician orders the test as a diagnostic service and uses the results to manage the patient's condition. Again, I know all of that was sounded very technical, but it goes back to, if you think you need this type of testing, please talk to your treating doctor. Next slide. What happens if Medicare denies genetic testing claims? Genetic tests billed to Medicare cost on average between $9,000 and $11,000. So you can see why these companies are so quick to try to defraud Medicare of that money. If Medicare denies the claim, you could be responsible for the entire cost. Remember, these types of tests should only be ordered by your personal healthcare provider who was familiar with your specific situation. Stopping genetic testing fraud. Here are a few things you can do to help stop genetic testing fraud. The best way to avoid becoming a victim of genetic testing fraud and scams is to be sure that your doctor has assessed your health condition. Although Medicare covers many genetic tests for diagnostic use, it only covers one preventative genetic test to screen for cancer. Do not give your personal information to strangers. Review your Medicare summary notices or EOBs and report strains or suspicious items to Senior Medicare Patrol. And at the end of our presentation, Janetta will go into more details about how you'd go reporting that to us. Now that you've learned, I'm going to hand it over to Janetta. Is going to discuss 3 ways to success in stopping healthcare fraud, waste, and abuse. Janetta?
Thank you, Nathan. So let's discuss those 3 keys to stop healthcare fraud. The first key is prevent. Protecting your personal information is your best defense against healthcare fraud and abuse. Treat your Medicare and Social Security number like your credit card. Never give out that information and those numbers to a stranger. Remember, Medicare won't call and ask for your Medicare number. Don't carry your Medicare card unless you need it for your doctor's appointment or your doctor's visit. Keep a record of your medical visits, tests, and procedures in a healthcare journal or keep it on a calendar. Next slide. The second key is detect. Knowing how to spot suspicious activity can help you stop healthcare fraud and abuse in its tracks. We ask our beneficiaries to review their Medicare summary notice, also known as the MSN, or the explanation of benefits, also known as your EOB, from your insurance company. Your Medicare summary notice is mailed to you by Medicare every 3 months. If you have a Medicare Advantage plan, you'll receive the explanation of benefits after you receive your healthcare treatment, healthcare services, or your doctor's visit. Compare your statements to your personal records and look for the following items: charges for something you didn't get, billing for the same services or supplies twice, services that weren't ordered by your physician. Next slide. The third and final key is report. If you suspect that you've been a target of Medicare fraud, we want you to report it. This will help you and it'll help other beneficiaries who are at risk of healthcare fraud and these healthcare scams. Here are some steps to report suspicious behavior. If you receive a suspicious call, don't give out any personal information. Report that call immediately to Senior Medicare Patrol. If you have questions about your Medicare statements, call your healthcare provider or call your healthcare plan. If you are not comfortable calling your provider, or if you're not satisfied with their response, you can call Senior Medicare Patrol for help. Next slide, please. So now you might be wondering, how can you help to become involved? Senior Medicare Patrol is always looking for civic-minded individuals to join our fight against Medicare fraud. The benefits of volunteering for our program include gaining the satisfaction of participating in a national effort to empower members of your own community to prevent, detect, and report healthcare fraud, errors, and abuse. Our volunteers receive training on the basis of Medicare and healthcare errors, fraud, abuse, and scams. In addition to giving presentations and attending community events, our volunteers participate in biweekly webinars and various training opportunities throughout the year. We also host a volunteer appreciation event in April for National Volunteer Week. Volunteering for the SMP program is extremely flexible, and it is done on an as-needed basis. Volunteers are offered these opportunities, and they have the option to decline if they're not available. They determine how often they would like to participate. We also want to mention that this is a great volunteering opportunity for couples. In the past, we've had couples to team up, to volunteer, give presentations, and attend community events. So if you think volunteering for Senior Medicare Patrol is something you might be interested in, we want you to give us a call at our toll-free number, 877-272-8720. We'd be more than happy to send you one of our volunteer packets and answer any questions you might have about the process of becoming an SMP volunteer. Next slide, please. As mentioned in our previous slide, we have a toll-free number. Again, that number is 877-272-8720. You can also visit our website, www.stopmedicarefraud.org, for additional information about our program. Additionally, we would like to encourage you to scan the QR code using the camera on your cell phone that will guide you to our social media platforms. This will include Facebook for Georgia, Louisiana, Mississippi, and our Spanish Facebook pages, YouTube, and our podcast, Sip and Learn with SMP, on Spotify and Apple Podcasts. I'd also like to mention that June the 5th through June the 11th, Senior Medicare Patrol will be celebrating our annual National Medicare Fraud Prevention Week. So please go and like our Facebook page, visit our website for activities and educational opportunities in your state during our Medicare Fraud Prevention Week celebration. Next slide, please.
All right. Well, thank you, Johnetta and Nathan, for that information. And yes, Johnetta mentioned Medicare Fraud Prevention Week, and we will be sending emails and posting activities that we're going to be having on all of our Facebook pages. So it's a really good idea for you to like us and follow us on those pages. That way you'll receive a notification when we add something new. So coming up next month for Webinar Wednesday, we're going to be discussing telehealth fraud and scams. This is something that has become more and more prevalent, especially with the pandemic and not being able to physically visit the office. So a lot of folks are seeing their doctors virtually. So that kind of opens up the door for scammers to find new ways to defraud Medicare and scam beneficiaries. So we're going to be talking about that in depth, and that webinar is scheduled for May 31st at 10:30 Central Time. So just be on the lookout, and we'll have the invitation and link for you to register shortly. All right, so now it's time for our prize drawing. So everyone who was registered prior to 10:15 this morning, their name has been entered on our wheel. And so I'm going to give it a spin. Now, you do have to be present to win. So if we get someone who isn't on, we'll take their name off and we'll just keep spinning until one of you become our lucky winner. So let's see, we'll give it a spin. All right, let's see, Mickey in. I don't see them on the call, so we're gonna remove their name and give it another spin. Let's see, Miss Guinevere. Nope, I don't see where she's on either. So let's take her name off and we'll just keep doing it until we have a winner. Oh, it looks like Vicki Jennings. And Miss Vicki, yes, she is on the call. So congratulations, Miss Vicki. I will be reaching out to you later to find out which gift card you would like to receive. So we'll be in touch to get that information from you. Congratulations again. You can let us know if you want a $25 Walmart or Amazon gift card. All right, so before we wrap up today's presentation, we want to open it up to questions. So if you have a question regarding the information that we presented today, please raise your hand. If you look to the right of your screen, there's a little hand button. If you click on it, it'll raise your hand and we can unmute your line and you can ask your question. We'll give y'all just a second to find that hand if you have a question. Okay. Let's see, Miss Vicki, you had your hand raised. I've unmuted your line. Do you have a question, Miss Vicki?
I do. In regards to one, thank you so very much for you guys putting this on. This is truly amazing. The training that we receive in regards, from the SMP program. It's just this short presentation. I learned a lot of valuable information that I like to share with my community. And my question is, are you able to have a small group on a certain day? If I have a group of seniors that I speak with, on a regular basis, and I want them to be a part of this, but for this presentation to be just for that group instead of them trying to sign on to be on this particular webinar. So do you guys offer that type of training?
Yes, ma'am, absolutely. We definitely do have in-person presentations. We just have to, make sure that we have a volunteer or a staff person in your area. But if you want, I'll send you an email after the webinar and get some information from you, and we can see where you're at and try to get that scheduled.
Okay, fantastic. Thank you so much.
Sure, you're welcome. And it looks like Mark has a question. Mark, I've unmuted your line. You just have to unmute it on your side.
There we go. My question has to do with genetic testing and proof of insurability, because I think that would be ordered by the insurance company and not the doctors. Do they require any kind of genetic testing for proof of insurability, health screening?
Monique, do you want to take that one?
Sure. Are you asking if Medicare requires it or other insurance companies?
Well, my understanding is that if you are on Medicare Advantage currently and you desire to shift back to standard Medicare, a proof of insurability is required. And my question is, if Medicare, or how do you know that if it requires a genetic test, how do you know that that's legit?
Okay, if you are on a Medicare Advantage plan and you want to switch back to original Medicare, you do not have to have proof of insurability. You just have to do it during open enrollment, or if there is a special enrollment period that you qualify for, then you could do it during that time. As far as the genetic test concern, there are a lot of legitimate tests out here. What we have found is that with the fraud cases that we've received, the beneficiaries are usually never notified of the results, or their providers are never notified of the results, and Medicare gets billed thousands of dollars for tests that we don't even know took place. Or if the beneficiary or their provider don't have the results, then it's meaningless. There's nothing that they can do, but yet Medicare has been billed for it. So does that answer your question?
Yeah, kind of. I'm just wondering if there are legitimate reasons for somebody to be asked to undergo genetic testing that may not be asked for.
Yes, so in many cases, there are times when it is legitimate, especially if a doctor feels that somebody has a history or family history, and they may
more by the
benefit
insurance company than
from
by
that.
your primary care physician.
Yes.
Is that ever an issue? In other words, it's
I'm sorry, you cut out. Say that last part again.
I'm just going to say, I'm wondering if there might be some instances where a genetic test is required by the insurance company and not by your primary care physician.
Yeah, I've never heard of it being required by an insurance company or healthcare insurance provider. I've only seen cases where it's something that's ordered by somebody's doctor.
I would be surprised if CMS even allowed this. I mean, well, it's a great question. I'm going to do a little research on it. We can get back with you to be sure. But I'd be surprised if CMS even allowed them to require that for a Medicare plan. Maybe it's like a life insurance, something that's separate from Medicare. I could see it be more likely. But I would be surprised. But I could definitely look into it a little bit. And if I find out anything more, I can get back with you on it.
Oh, okay. Thanks, Nathan. Yeah, it might be more of a life insurance issue than a healthcare insurance issue.
Yeah, that's what I was thinking.
Okay, let's see. We have one more question. Miss Peggy, I've unmuted your line. You just have to unmute your phone and you can ask your question.
I was wondering, you get so many Medicare calls. Is it actually good to report everyone you get, or just report something that's on your bill?
So, a lot of folks are receiving those scam phone calls, and we talk to beneficiaries every day, all day, who, their phone is just ringing off the hook, really, with folks claiming to be with Medicare and wanting their information. You don't necessarily have to call and report every single one. A lot of times these individuals, they're spoofing telephone numbers. So, it makes it appear as though they're calling from your immediate area, but they're in another country a lot. So it makes it really difficult, to track these folks down and stop them because they're always on the move. And a lot of times if we try the number that they're calling from, it's not even a working telephone number. So what we do is, we're just telling individuals not to give out their information over the telephone, when they receive those phone calls. A lot of times if you don't recognize the number, we say don't answer. I know that's not always possible because you're getting calls from doctors' offices and such, and you may not know the number that they're calling from. But, just being really careful and not giving out your information to those people when they call and try to pass themselves off as Medicare or somebody else. And then reading those statements. So that's a big important piece of it is when you get your Medicare summary notice or your explanation of benefits, open that up and take a look at it and make sure that every date and charge and, if there's labs on there, make sure all of that does in fact belong to you. And if you see something that looks suspicious, then we want you to report it to us. That's something that we can look into for you.
And also be careful. We talked about it a little bit today, but a lot of times these scammers, to get you to let your guard down, are going to say, we spoke with your doctor's office that you have this issue. First, your doctor can't just willy-nilly share your healthcare information, first of all. But when in doubt, call your doctor's office. Say, hey, did you refer me over to this company for this testing or for this equipment? Ask them, because they will lie and tell you that they already spoke with your doctor. But a lot of times, most of the time, I would say that's not true.
Yeah. Right.
Okay, thank you.
Sure, you're welcome. Good question.
Yeah.
All right. And Mark, your hand is still raised. Did you have another question?
No, I didn't. I don't know why my hand got raised again.
That's okay. I'll lower it. All right. Well, I don't see any other questions. So we will go ahead and wrap up for today. Let's see. I can get that back. All right. So this is going to conclude our presentation today on genetic testing, fraud, and scams. Everyone will receive an email after the webinar today that has a link to a short survey It's really brief, and we would really appreciate it if you would take the time just to answer a couple of questions, let ACL know how we did today. And thank you again for joining us, and we hope to see you all again very soon, and have a great day.